Many aspects of healthcare are intertwined. Our emotional and physical health go hand in hand. Doctors at the Cornell Scott Hill Health Center work together to treat the whole patient through integrated care. And joining me today are Dr. Tom McNamee, the Interim Chief Medical Officer, and Nancy Navarrete, the Chief of Behavioral Health Services. It's great to have you both here. But first of all, let's establish how serious this is, mental health and substance abuse in our area. How big of a problem?
Big problem. People do not have access to services. In a clinic like ours, there's no wrong door to treatment, so people are welcome wherever they show up in any one of our clinics.
And so when they walk in, what kind of care should they expect? We talk about integrated care.
So we talk to one another. Our teams work together. If someone comes in for counseling, they can be referred for physical health and vice versa.
And in turn, a medical screening will also involve screening for any of the psychiatric disorders. Even minor depression is something that we can then automatically refer over to behavioral health services.
It's really unique with the program that you have there.
It's very unique.
And why is it so unique?
Because I think our goal is to treat the entire person. And that mental illness is a disease just like any other disease, and because we have the capabilities to integrate and have people on site for both physical and mental issues, we can destigmatize so much of the issues and get the person taken care of as a whole.
Now we really talk about, as you said, you treat the patient as a whole, mind, body, and soul. So where do you go, how do you attack it first?
Well, I think it depends what door they walk through. And we're all sensitive to the screening as far as if somebody comes with a physical complaint, there'll be enough questions and opportunity for a patient to discuss any other issues that may be brought up. And we may even, prompt them to elicit, to discover or disclose information that otherwise would have been, kept hidden.
And then?
We want the healthcare experience to be a positive one for everyone that walks through the door. So we want people to be comfortable. We want them to be comfortable with their provider. We want their provider to understand mental health issues, substance abuse issues, as well as the physical issues.
What are some of the physical effects of mental health?
Well, depression and anxiety can lower your immune system, make you more susceptible to catching colds, not being missed days from work, for example, so it can affect your employment. And then we have the much larger serious issues of people with serious mental illness dying up to 25 years earlier than the general population.
That's something that people don't know about.
Correct. And whether it is a fact that people, as Nancy had alluded earlier, have difficulty with access. And people with mental illness are sometimes stigmatized and they cannot get the mental issues taken care of, but the physical ones that are behind it in some cases.
And that's why you have this program at your center, because it's what people need is access.
Access. So you may come in with mental health issues, have hypertension, diabetes, obesity. These are all issues that we can deal with under one roof.
Absolutely. There is a certain stigma associated with mental health. Let's take a look at what some of those are. And a stigma comes from really misunderstanding the issue.
Correct. It's a people don't look upon it as a disease. They look upon it sometimes as almost a ridicule. And people, because of that, are often afraid to disclose that they feel different or that they don't understand what's happening to them. And it's not a physical sense, but it's almost like just a gloom. And we have to be able to encourage people, as Nancy said, to be confident in their providers enough to disclose that. And the behavioral health providers teach us, as well as we can help them with the medical issues. So.
And the stigma really also causes people to become isolated. Is that right, Nancy?
That's right. And the label alone is a burden that people carry, that people don't understand. There's a lot of fear around it. So the providers at Cornell Scott Hill Health Center are more sensitive to those kinds of issues and are more welcoming of the patient.
And it really fills people with self-doubt.
Correct.
And so families really need to understand that.
Yes, and not hide it.
And at our center, we treat children, adults, families, substance abuse, mental health. So all of that can be addressed under this one umbrella of services.
What are some of the ways we can overcome that stigma? You say to really seek that treatment.
Communication, educating the consumer, in this case, which is a patient, that that there's nothing wrong with expressing what you feel is wrong with you, and that a mental illness, like any other, or an addiction, is the same thing as having something like diabetes or hypertension. It's a treatable illness that should be recognized and taken care of.
Nancy, also join a support group. Is there a support group there?
We have many different kinds of support groups, groups for children, groups for families, parents, parenting groups, relapse prevention groups. So you name it, we address it.
We also need, as you said, speak out against it.
Correct.
We also really need to communicate that as well. Why is that so important?
Well, again, to encourage access, that if we can destigmatize and encourage people to come in for treatment. And that's why it's important from the medical side, so to speak, that when we have a patient that we very clearly not just take care of, the eyes, ears, nose, throat, lungs, et cetera, but go into the deeper issues, including domestic violence and addictions and substance abuse, et cetera. Yeah.
Lots of information to know about, and if you want more, all you have to do is go to Cornell Scott Hill Health Center and call their number 203-503-3000, or go online at hillhealthcenter.com. Thank you both for being here.
Thank you.
Thank you for having us.
Mental health issue, a major issue that we all need to know more about.
Absolutely.
Up next on